Well, good evening, good evening, good evening. Thank you so much for tuning in tonight to the virtual conversation. It's entitled Get COVID Clear, presented by the Chris Howell Foundation in partnership with the City of Arlington. We've got a great conversation lined up for you tonight. We've got two guests in studio with us tonight, and then we've also got City Councilwoman Nikki Hunter, who's joining us on via Zoom. So we've got a great conversation. Nikki, I just want to just do a sound check real quick. Make sure that you're coming in okay. Can you hear us on your end?
Yes. Can you guys hear me?
We can hear you. You guys are hearing her okay?
Yes.
Good deal. All right. Well, thank you again for being here. We're going to get into the conversation. If you're viewing on Zoom, Facebook, YouTube, wherever you may be logged into tonight, this is an interactive conversation. It's an interactive conversation. We want to hear from you. We want you to be able to ask your questions. We understand that families are getting ready to get together for the holidays, and we want to make sure that you do that in a safe and responsible way. So we want to make sure that you have all the information that you need should you want to engage your family in conversation and talking about the pandemic that we're still in the middle of. I know numbers are trending in the right direction, and we're certainly glad about that. But so many times when that happens, we tend to let our guard down just a little bit. And I know you haven't seen family in a while, but as you get together, we just want to provide you with the most accurate and up-to-date information so you can do that in a way that allows you guys to have a great time, be safe, and when everyone leaves there, everyone is still healthy and in the way in which they came. So that's what we want to do here tonight. As we get into our conversation, let me first of all introduce our guests. I'm going to give you their bios, read a little bit of their bios just to get a little bit more background on them, and then we'll get into our conversation. Again, joining us via Zoom is Councilmember District 3, Councilwoman Nikki Hunter. Nikki Hunter has been serving the Arlington community for several years as a volunteer and community advocate. She has served on the board of directors for the YMCA, Arlington Friends and Foundation, and the Arlington Rotary Club. She has served as president of the Rotary Club and more recently area governor. She currently serves as a city councilwoman for District 3. She's enthusiastic about her work and happy to support any and everything that goes on in District 3. You will frequently see her at neighborhood events as well as local events that take place in District 3. She truly cares about her district and wants the best for that neighborhood. She says she's elected by the people, she's for the people, and will do everything in her power to serve every resident in her district. So Nikki, thank you so much for serving the folks of Arlington and District 3. Also joining us tonight is James Bouquet. James Bouquet is the Arlington Fire Department Medical Operations. James Bouquet is the Deputy Chief over Medical Operations for the Arlington Fire Department. James has been in the fire service for 30 years. James Bouquet has worked with the Arlington Fire Department since 1994. He was promoted to company officer in 2005, then promoted to Deputy Chief in January of 2020. Chief Bouquet was assigned over the Medical Operations Division in August of 2020, where he has been heavily involved in leading the Arlington's response to the COVID-19 pandemic. And we're going to hear more from him tonight and how those efforts are going. Also joining us tonight is Victoria O'Whaley. Victoria O'Whaley, as her exact title is Victoria O'Whaley is the Public Health Unit Registered Nurse at the Arlington Fire Department. So again, certainly glad to have her with us tonight. She's again a nurse and has been in healthcare profession since 2010. She's a passionate about public health specialist, respected for developing programs impacting large communities, dedicated to providing individuals with outstanding care and support to help them improve their quality of life. She has over 8 years experience in infection control, infectious disease investigation, and disease surveillance, qualified in delivering results primarily within the medical and health sector. She's an outstanding and experienced in developing research programs for automating medical facilities and equipment, talented in developing standards and guidelines in the investigation of causes of disabilities, disease, and other ill health conditions. She's currently the public health nurse community advocate lead at the Arlington Fire Department, a public health unit. Her vision for the community as a public health nurse is to ensure health equity without discrimination of race or color. So again, that's our panel tonight. We've got a great conversation lined up. I gave the guys, everyone your bio. Let's tell them first of all who you are as an individual.
Victoria O'Whaley. I actually hail from Africa, precisely Nigeria. I've been traveling all over the world, in quest of knowledge in the aspect of public health. I finally found myself in the United States, which has been my dream because the U.S. stands out to be one of the top countries as regarding healthcare. So I decided I need to come in and acquire the knowledge and impact, the world as regarding healthcare. And I'm actually getting what I'm here for in the U.S. as regarding my profession.
Good. Well, we're certainly glad to have you here. James, tell us a little bit about yourself before we get into the conversation.
Well, mainly, like I said earlier, I've been in the fire service for 30 years. This has been my first stint in the fire administration. Unfortunately, it was mid-pandemic, so it's been a little bit of a interesting role during this process, but we've accomplished a lot that we weren't expecting to. Our business model is not this, but we have tweaked it and changed it. And bringing Victoria on is just another example of us expanding our public health mission within the fire department.
Absolutely. Well, thank you so much for being here with us tonight. All right. Now we also have Nikki Hunter, who's online with us. Nikki, tell the folks just a little bit about yourself.
Yeah, well, I've been kind of in the background in Arlington for several years, just in the community, out just helping wherever I can. I'm one of the newest city council members. I was elected back in June, and just happy to serve District 3 and Arlington any way I can. I truly do love my district, and I truly do love Arlington.
All right. Well, again, thank you so much for being with us as well. As we talked about in the opening, numbers are certainly trending in the right direction, and Arlington is one of those cities that's certainly seeing that. As we get into this, James, we're seeing a downward trend in hospitalization for COVID-19 in the city of Arlington. In all 5 of the Arlington hospitals, certainly numbers are down. Ventilator use is also in a downward trend in Arlington hospitals. I guess the question I would have for you is, what do you attribute this success to?
I think the number of people being vaccinated, and now with the increase of number of people getting the boosters, third dose, however you want to call it. But when there was a spike in the hospitalization, especially in August and so forth, majority of those folks were not vaccinated. So it definitely, you can see the numbers going down with the increase of the vaccinations.
Yeah.
The vaccines do work.
The vaccines do work.
Yes,
absolutely. And that's what we want to talk about tonight as we get into this, because I think that's one of the challenges that we're finding today when we do see the spike. In many cases, it again, in the hospitalizations, in many cases, it's those folks who are not vaccinated. So I think it's important that we talk about that. But I guess as we get into one of the latest things that we've seen is, of course, the ability for minors to be vaccinated. So as we get into this, what are some of the concerns, or are you hearing most, Victoria, when parents are concerned about getting a minor vaccinated? How can we help folks to overcome maybe some of those objections tonight?
Well, from my point of view and the reviews we've been getting from people coming into the pod, they usually say, my kid want to get vaccinated, but I already got vaccinated. And from the experience I had, I don't know the way it's going to react, in my child, or how he's going to feel down and stuff like that. So I'm like, there's no vaccine without a reaction. Definitely there's going to be a reaction. It just depends on the way your body reacts to the vaccine. So if parents are able to give their consent to children age 12 and above based on the CDC guidelines for vaccination for younger ones, I think it's going to help during this holiday season, because those children will want to be around their grandparents, they want to be around friends and families without, thinking of COVID. So I think my advice is for parents to actually give their consent, because we have some of those children that want to get the vaccine, but the parents are not giving them the consent because they are not of age to decide for themselves, for those that are below the age of 18. So, yeah.
Yeah. And I think, James, coming to you, we've seen, and certainly it's been reported that, the vaccines are, in fact, safe for children. It's been approved for those, 5 to 11 years old. Talk a little bit about that.
Right now, at this point, we're trying to avoid the 5 to 11 age group. Okay. One, it's just a different vaccine altogether. But we are offering for 12 and up with a parental approval, of course. And we have had quite a few kids ever since we did a program with AISD, Kennedale, Mansfield schools, private schools in our area, and we did clinics just for those school districts, and we're quite successful in starting as soon as Pfizer approved those.
Okay.
So we've been very fortunate in Arlington to be able to have all 3 vaccines. So that gives a lot of people choices. It gives us a lot of options. So when somebody comes in, whether they're a minor, we know they're going to get Pfizer, but if they're not, and as an adult, you have a choice between the Moderna, Pfizer, J&J. Everybody has their preference, and we just try to educate them on that. But the 5 to 11 is brand new, and we are at this point not prepared to jump into that lake right now.
Okay.
And not just because it's a a different vaccine altogether. You have to order a different vaccine.
Okay.
It's not just a different dose.
Yeah.
So with managing the 3 that we have right now, I think we're going to try to see if those can be served by the pediatricians, other healthcare services.
Mm-hmm.
If there becomes a need and we're needed, I'm sure we'll jump in.
Yeah, yeah.
At this point,
Because you guys are handling quite a bit.
Yes,
one of
sir.
the things I really want to highlight, and Nikki, I want to come to you for this particular point. One of the things folks may be asking, well, you're talking to Arlington, but what about Dallas, Fort Worth, and all these other cities? One of the great things about Arlington right now is that you do not have to be an Arlington resident in order to go to the center to get vaccinated. You can come from as far as Frisco or as far as South Dallas. I mean, wherever you need to come from, you don't have to be an Arlington resident. And I think that is a great benefit. So, Nikki, talk about that aspect, the fact that you guys decided as a city, you know what, we're not going to put any restrictions. If folks want to be vaccinated within the city of Arlington, we're going to give them the ability to be able to do so, even if they're outside the city.
Well, I think that's a great decision made by the city. And I just want to start by saying I think our fire department here in Arlington has done an amazing job from the beginning. They stepped up and they gave some of the first vaccines out there. So I want to praise our Arlington Fire Department on that. And, I think the decision to not put the restrictions in, I think, at the end of the day, vaccines, it's a very personal choice. Definitely your view on vaccines might not be the same as my view on vaccines. So I think that's probably why that decision was made on there. But nevertheless, I think we're doing good as far as vaccines. As you said, the numbers are down. I think we have more people that have taken advantage of the different locations, including the fire department, where they can go and get vaccines on there. And I think a lot of people are doing their own research, making their own decisions. And I think there's a lot of people that's coming around to vaccines on there.
Yeah, absolutely. Well, again, if you are just tuned in with us, we're having a conversation tonight. We're allowing you to get the facts on COVID-19 and the related vaccines. Again, we're speaking with folks from the city of Arlington tonight. But again, you don't have to be an Arlington resident in order to get vaccinated. You can go from as far, again, we said it a moment ago, from Frisco or South Dallas to go to Arlington to get vaccinated. Ages 12 and up will be able to get a vaccine there. The number to call would be 817-575-3700. Again, 817-575-3700. No appointments are required. It's being done Monday through Friday from 9 a.m. to 4 p.m. Again, we're having this conversation tonight, understanding that many families are about to get together for the holidays in a few weeks for Thanksgiving, first time in maybe over a year. So here's an opportunity for you, if you choose to get vaccinated, to be able to do that in a safe way. The address is 2920 South Cooper Street in Arlington. It's 2920 South Cooper Street. No appointment required, Monday through Friday, 9 a.m. to 4 p.m. And the number is 817-575-3700. All right, James, we talked about the fact you don't have to be an Arlington resident in order to get vaccinated in Arlington. Do you need any documentation at all in order to get vaccinated?
No, sir, you do not. You just come in. We fill out the registration. Either you can do it on your phone through an app, or we have a service pros out there in the lobby to get you registered. If you've not been to us for your previous dosages, it's a little bit, just takes a few minutes to get registered. Mm-hmm. But and then for the minors, they just have to bring in a guardian. But there's no documentation required.
Wow. Yeah. So no documentation required. That simply probably means then, Victoria, that you don't have to be a United States citizen in order to receive the vaccination. I think that's one of the other myths or misinformation pieces that's out there.
Yes.
Do you have to be a U.S. citizen?
No, sir.
Not at all.
Not at all.
Okay. So again, we're having a conversation tonight, and we really want to hear from you. So it's an opportunity for you to ask your question as well. If you're viewing on any one of the platforms, simply put your question in the chat, and we'll be sure to get to your question as well. So let's get into maybe some of the myths. And I think one of the ones that we've been doing some research and kind of going out on the street, and we've been talking with people, one of the things that we're still hearing from most women is that concern that COVID-19 vaccine can affect women's fertility. Victoria, you want to speak to that?
Oh, yeah. Based on research, I've never read articles or research stories that has brought facts about women not being able to conceive after getting the COVID vaccine. The only complications there is when you're pregnant and you don't get the vaccine at an early stage. It could lead to a lot of complications when you get the COVID during your pregnancy period, and after that, you're now trying to get the COVID vaccine. So it's safer to get the COVID vaccine while you're pregnant before getting the COVID itself. So there is not been any success stories or research articles out there that has proven to the world that COVID vaccine, affects fertility. I've not read none.
All right, good
And
deal.
it's kind of like Councilwoman Hunter said. She was saying it's a very individual choice.
Mm-hmm.
So what we try to do is with any vaccine we have all the fact sheets for that vaccine. We provide those facts for those people, let them make their own educated choice. We do not recommend one over the other. When somebody asks, which one would you do? We just go, that's your choice. We're lucky enough to provide you all three choices. At the beginning, it was very limited, and vaccines were very limited, and people were struggling with getting able to get their second dose and so forth. So now the tables turned. People have more access to it, and they have access to the different types. So what we try to do is just try to provide them the facts for all three and let them choose.
Yeah.
Yes,
And
sir.
I think that's important.
Yeah.
Just again, provide the most accurate and up-to-date information, and then allow folks to make their own educated decision.
Yeah.
So I like that. Now, one of the other things out there is that if I've already had COVID-19, I don't need a vaccine. Councilwoman Hunter, you have any experience with that and want to speak to that in any way?
I don't really have any experience to it, but that would probably be a better question for the nurse. To be honest, I don't want to give misinformation.
I knew you were gonna say that.
You guys work together all too often, huh?
Well, if you already have the COVID vaccine and you've not been vaccinated before having the COVID, you have to make sure you get tested and you clear, like you have a negative result before you can go in and get the vaccine. We had incidents of during our outreach programs, people come in and they want to get the vaccine, but as a medical person, you look at someone, you could tell if they're actually having symptoms. We do testing for temperature screening, and we discovered actually this resident was having a very high fever, and we could not give her the COVID-19 vaccine. We had to let her, go do your 14 days quarantine and make sure you come back with a negative test result before we can give you the vaccine. So it's very advisable after the period of symptoms of the COVID, and you go for your test and your healthcare provider confirms that you are negative, you can go for the COVID vaccine. It's safer for you to come get the vaccine than not getting it at all.
Yeah. I like how you guys are working in conjunction with the healthcare provider that they're going back to see,
Yes.
and then coming back and getting the vaccine from
Correct.
you guys. Yeah, I like that teamwork there. So, James, I may put you on the spot here because I'm sure you probably don't have today's numbers, but maybe the number of folks that you guys have been able to vaccinate within the city of Arlington.
Total, we've done over 230,000 people.
Wow.
Yeah, it's of course when we first got into it, it was the mass vaccine, and then which we honestly, that was not our goal when we started this process, but we kind of fell into it and we adapted, and we were supported by our command staff, our city management, and it was a group effort throughout the whole city. Multiple city departments were involved, and we just kind of adapted to it. And then we were able to team up with the FEMA, with presidential declaration for the vaccines, and we worked with them for the 8 weeks that they were with us. It was cut a little short because of we tried to transition to J&J, and that was at the time it was put on hold. But and then when the FEMA was here, we were still involved and we were still managing the vaccines, but that's when we kind of went off to do our outreach programs and to start at our public health unit. And so now we've transitioned more to, smaller, doing maybe 100 to 150 a day.
Okay.
Compared, we were doing almost 5,000 a day or 4,000 a day.
Yes.
But it's also more manageable. And but now we are seeing, the increase with the boosters and so forth. But yeah, it's been well over 230,000 people we've done.
Wow. So when you look at the fact that, again, the numbers are, like we talked about in the opening, the numbers are going in a downward trend. Certainly, again, that's an encouraging thing. That's good. But when you look at the fact that we're quickly approaching the holidays, the weather's starting to get a little bit colder outside, things of that nature, folks are staying in more, maybe congregating more, things of that nature. Does it draw any concern for you?
Of course, like you said earlier, people get complacent because the numbers are down, because of, it's just becoming, things are almost back to normal per se, and a lot of the venues and so forth. So, but it's everybody's responsibility to take care of themselves and their family members, and we see a lot of that. And we, like you said, a lot of people saying, I want to see my grandparents this holiday, so I'm getting the vaccine because they won't see me unless I don't, and stuff like that. And it has been interesting to see how important the vaccine is to certain folks.
Mm-hmm.
And so we'll see.
Yeah. Councilwoman Hunter, I want to come to you. And as you said, it's a personal thing for everyone, and everyone has to get to the point where they make that decision for themselves if they are not, in fact, vaccinated. But maybe for family members who want to get together and like the chief just talked about, maybe one family member is vaccinated and they're telling the other family members, I really don't want to get with you if you're not vaccinated. How do you approach those conversations? And sometimes I think it seems that it's even difficult for family members to even have that conversation because they don't want to get into this battle of words or philosophies, if you will. So how would you have those conversations? How do you encourage folks to have those type of conversations?
Definitely, that's a good question. For my family, we are all vaccinated, but another family, again, like you said, it's a personal choice. So we do have to be considerate of others. If you're not vaccinated, and maybe you're going to grandparents' house, maybe wear a mask if that's something you're willing to do, or social distance. And I know during Thanksgiving, during Christmas, that's not something people really want to do. But we do have to be considerate. We still have our high risk groups. We have our older, our elderly that's high risk. We have anybody with any type of. I have diabetes, so I'm high risk. And that's kind of what drove my decision to go ahead and get the vaccine and, to wear the mask when needed on there. But that's my choice. That's my choice. And I definitely can't force that on anyone else. But when we're dealing with family members and we're dealing with loved ones, and we've seen the stories as far as how fast this virus can spread in a room, we do have to be mindful this holidays. We do have to make that decision. If you're not vaccinated and you are going around grandparents, definitely either social distance or find ways that you can still have your fun with your family, but you can do it safely. So it's just having those open conversations, and sometimes it's hard conversations because everybody's not going to agree, but you have to have these conversations. We have to have them before Thanksgiving just so people know what to expect on there, if that makes sense.
Absolutely makes sense. Thank you so much for that. And again, I think it's important when we talk about getting together for the holidays. One of the reasons we wanted to do this conversation today was, I guess, the timing. And either one of it, Victoria, I guess, come to you in terms of ensuring that you're able to safely gather. I guess from the time you get vaccinated to the time that you actually start congregating with family, give me a time period. Is it 7 days or 14 days? What's that time period in terms of we ensure that we're fully vaccinated and able to gather?
Oh, well, fully vaccinated depends on which of the vaccines you take. Moderna, Pfizer, J&J, they have their time frame. You get your first shot, then you have to wait either 28 days or 30 days, 3 weeks. Just depends on which of the vaccine you take. So once you have your first and second shot, as long as you're vaccinated and the other partner is vaccinated, it's just a matter of choice, like we said. So you can decide to go in with your mask even after being vaccinated, just for extra precautions. Mm-hmm. So, because the fact that you're vaccinated does not mean you cannot get, the COVID coupled with the Delta variant out there. So we are just trying to make sure everybody is in the know that no vaccine is 100%, guaranteed that you will not get the virus.
Absolutely.
So, yeah.
I think it's a very important point. Again, we don't want to make sure that we're not saying that get the vaccine and you don't have to wear a mask or any of that stuff. You definitely do still have to wear a mask.
Yeah, especially when you're among, crowds, more than 10 to 15 people gathering together. Mm-hmm. That's considered a lot of numbers. So,
okay. Yeah. You can still contract and transmit the virus onto someone else.
Yeah, of course.
And like Victoria was saying, it depends on each vaccine, but the Pfizer, your second dose is 21 days later, and Moderna is 28 days, and it's technically it's 2 weeks after your second dose before you're technically fully vaccinated.
Okay.
With the Johnson & Johnson's, like I believe 42 days from your initial, because it's a one-shot
Okay.
vaccine, so it's 42 days to be completely. And so that's one of those myths you talked about, where people think, well, if I get my first dose, I'm vaccinated. No. It's a series, and it has to be completed, and then you have 2 weeks for it to completely, for the efficacy to complete out.
Yeah. So if you're trying to get on the road to that, then you need to be starting that pretty soon.
Correct.
Yes.
Yeah.
Yes.
You know what? Someone asked. We had a question to come in a moment ago. Someone asked the question: do you have to go back to Arlington for your booster? That's the question.
No, and I think that's one of the good things about where we're at right now with vaccines, because like we discussed earlier, it was very difficult. We had all the registration issues. Everybody was registering whether Dallas County, Tarrant County, Denton County, whomever called them first, that's where they were going and so forth. But now you're able to go to your corner pharmacy and get vaccines. So you can, you have more options. So like for us, if you got your vaccine elsewhere, all we do is register you for our system, and then we provide the series that you need, whether it's your first, second, or your booster. And others do the same.
Okay. All right. Well, we've got a few more questions coming in. I think we may have just answered one of them with what you just said. That question was, should we go back to Arlington for the second dosage and the booster? But again, as you just stated, they can pretty much go anywhere to get the second dosage or the booster. Of course, we would want them to go back to
of
you.
course. Of course. It is I'm not going to lie, our process has been very smooth throughout the whole time, even when we were doing the 4,000 a day.
Yeah.
We've been very fortunate to have a good turnout. Very, very seldom do we ever have waits and so forth.
Yeah.
So especially if you did come to us for your first dose, when you come back for your second dose or for your booster, it's a very quick process because you're already in the system. We just verify, you have not had any other vaccines in 14 days. You don't feel sick today. The standard questions that we go down, and then boom, you're done, and you're 15-minute observation, and you're on your way.
Wow. And again, no documentation required. Again, you do not have to be an Arlington resident or Tarrant County resident for that matter. You can come from any one of the surrounding counties and go to, again, 2920 South Cooper Street in Arlington. The number to call is 817-575-3700. Again, that's 817-575-3700. Again, ages 12 and up. In the city of Arlington, Monday through Friday from 9 a.m. to 4 p.m. and no appointment required, so you can go and take advantage of that. Said, should we wear a mask with family members this holiday season? And again, I think, Victoria, you just answered that question. It is a resounding yes. Absolutely yes.
For me, I'm vaccinated.
You even had yours on a moment ago.
Yeah, I'm like,
you're perfectly okay. Victoria's like, I'm not trusting you. I don't know you. All right. So again, the other question was, if someone doesn't have an ID, what documents can they bring in place? Again, you don't have to have an ID. Correct.
No.
I don't want that to be me saying that.
No ID required.
No.
Yeah.
And a lot of times, if we're helping somebody do the registration because they're struggling with it, we do ask for an ID just because it's easier for us to read it's quicker to read the driver's license, address and so forth. But it's not required.
Yeah. So no ID, no insurance information, any of that stuff. Do not have to be a U.S. resident.
No, sir.
Yeah, don't have to be a U.S. resident. The other question was, does Arlington have transportation to receive the vaccine?
The fire department itself in the city, we do not, unless you're working with one of the other organizations that do provide transportation. But no, we do not.
Okay. All right. So again.
I just want to add to that. We have what we call the homebound, just for those that cannot,
We do have an outreach program that if somebody is physically homebound where they cannot get out because of illnesses and so forth, that we do go and provide homebound vaccines at their location, at their homes. But it can't be just because somebody doesn't want to get out of their house or scared to get out of their house. It's because they don't have, physically they cannot leave their residence for illness or other reasons.
Yes, but again, I would think they would have to be within the city of Arlington for that. Is that correct?
That's correct. Yes.
Okay. All right.
Yes. And
so if you're an Arlington resident and registered as homebound.
Yeah, you can contact that same number and for the homebound
Okay. Again, that same number is 817-575-3700. Again, 817-575-3700. As we get back into the myths, and we're still taking your questions. So any question you have, please put it in our chat box, and they'll get those questions to us, and we'll be sure to answer as many questions as we possibly can. This is an opportunity for you to get the answers that you desire. So again, we're going to talk until you send those questions in, but it's an interactive conversation. We're here tonight to make sure you have the most accurate and up-to-date information, not the information from the barbershop or the beauty shop or what your cousin told you. We want to make sure you hear from the experts themselves. And again, the reason we're talking with folks from the city of Arlington, because again, Arlington is one of the few cities that's allowing you to come from anywhere throughout the Metroplex in order to be able to receive it. Wherever you're listening from within the DFW Metroplex. Or if you just happen to be coming to Dallas, you live in Chicago, but happen to be coming to Dallas, you can very well go over to that same location as well in order to get the vaccine. You just, again, take care of the second dose, maybe in Chicago, or come back to Arlington and do it. But it's open to any and everyone. One of the things that we talked about in terms of the myths, folks are saying that researchers rushed the development of the COVID-19 vaccines, so its effectiveness and safety cannot be trusted. How do we address that?
I think it's all perception, and I think the amount of manpower and hours that was put into it was equivalent to other processes. It was just that much. It was such a high priority. It was that much workforce hours put into it. It was compressed time, but I'm definitely not a scientist.
Yeah.
But I think the effort and the knowledge was it was the best of the best that worked on these things.
Yeah. All right. Well, Victoria, I want to come back to you. You talked about it a moment ago when we were talking about, again, no vaccine is 100%. Again, there is those potential for breakthrough cases, things of that nature. But again, what we're saying tonight is if you are vaccinated, again, you decrease the opportunity or the risk of being hospitalized or becoming deathly ill as a result of COVID-19. Okay. So that's what we're speaking to. Is that correct?
Yes, correct.
Yeah. So talk about that again, those factors, and again, how it's in your best interest to be vaccinated as opposed to not being vaccinated.
Well, if you are vaccinated, especially those that are high risk, you stand a chance of not being hospitalized for a very long period of time, even if you finally, get hospitalized, compared to when you don't have the vaccine at all. Mm-hmm. So it's advisable, because the advantage compared to the disadvantage of not getting the vaccine, it's on the high side. So for me, I would like to share my experience with the vaccine. Maybe that will help, people to get vaccinated. I have grandparents at home that are high risk. They got the vaccine first. And I was like, really? Are you still alive? The next morning I went, I was like, are you still alive? What was your experience, over the night compared to all the stories we've been hearing, people, sleepless nights, sore arms, headache, fever, diarrhea. They're like, they never had any symptoms and they're high risk. So I'm like, okay, I'm the health person here and I'm telling people I'm not getting the vaccine. Mm-hmm. Initially, I said I was not getting the vaccine. Mm-hmm. But over the months, I was like, no. Despite the fact that I, went to school, had my public health master's degree, I took a research class, and I know all the clinical stages that a vaccine needs to go through before it's considered, a standard vaccine for the people to get it. So I was like, well, this COVID vaccine is still on the third clinical phase. Mm-hmm. It hasn't gotten to the final clinical stage. So I'll wait until it gets to the final clinical stage before I'll go get my vaccine. So just a few months later, after my grandparents got their vaccine, they were like, we need to talk to you. You are the health personnel, in the family, and we expect you to be the first person to get this vaccine. Consider that you are out there talking to people, being around people, because you go out more than we do. We are always home, so we don't even know if you are bringing the COVID, to us, and we are high risk. So I was like, they are actually making sense. So I sat down some couple of weeks, and I told myself, you know what? You need to go get this vaccine. So I went out the very first day to go get the vaccine, and I went back home. I'm like, I'm not getting it. I'll go. So the next night I was like, God, just, give me the grace to be able to get this vaccine. I've heard a lot of people said negative things about this vaccine. I'm not ready to die now. And I don't want to have any complications, whatever. If actually people can go get the flu shot and still end up getting the flu, there's no sense in me saying I won't get the COVID vaccine because I don't, want to get the vaccine because it hasn't gotten to the final clinical stage trials that it needs to go through. A lot of people have gotten it without complications. They are still very much even healthier than when they got the vaccine. So I said, I'll go get it. Yeah. So I took the bold step. I went, I got the Johnson & Johnson because I was like, I don't want 2 shots. Yeah. I just want a single dose. So I got the Johnson & Johnson and I never had any critical, symptoms. I only had like a migraine headache and which lasted for just 48 hours and that was all.
Wow.
Yeah. So to me is a matter of being convinced, taking away the fear of what the vaccine is going to do to your body system. So there's no vaccine without side effect. Every vaccine has its own side effect. So people being scared of COVID, we've had a lot of pandemic over the years and our research has come out with, vaccines that helps those pandemic, considering the influenza, virus pandemic. It killed over 500 million people globally, and COVID has not even killed over 300 million as compared to the influenza. So if people could take the influenza vaccine, then why not take the COVID vaccine? Yeah. I do not see any negativity in COVID-19 vaccine because I personally never wanted to take the vaccine, but I just said to myself, COVID-19 vaccine is as good as every other vaccine that has been, made by our research to help curtail, the death rate for every pandemic that has occurred over the years. And we are still looking forward to more pandemic in the future. It's just for, the public health to come together and be able to, prepare like a vaccine that will be able to help for any pandemic that comes out before research keeps going on to be able to bring out a effective and efficient vaccine. Yeah. So I think COVID is just like a wake-up call for public health sector for us to prepare for the forthcoming pandemic. So yes. COVID-19 vaccine is effective. I have taken my shot and I'm happy I took it, despite the fact that I still take, extra precautions just to make sure, I'm not spreading nothing, being a public person. So I advise everyone there that has been having the fears of getting the vaccine. It doesn't mean you are going to have negative reaction. It just depends on your body system. Most people that have died either after taking the shot must have had a very high risk condition that they are not even aware of. So taking the shot only triggered what was in them. It's not actually the COVID that, caused the death. So some people might be sick, but they don't have insurance to go see the doctor. They come get the vaccine and they go home and, they just discover their death. It's not the vaccine that actually caused the deaths. They might have internal illness that they are not aware of. So getting the vaccine is very helpful. I encourage everybody considering this, holiday season. Last year, December, Christmas, by January, the cases were very high. Yeah. So we are trying to make sure we don't have a repetition of what happened earlier in the year 2021 come January 2022. So we are encouraging people out there, please go get this vaccine. It's very effective.
Absolutely. Yeah. Thank you so much for sharing your personal story. Again, I think that helps to understand that, there would be some hesitation, but again, you received the information that you need, and the encouragement from the grandparents, I'm sure was a weighing factor. And then you went ahead and got it, and you didn't have any problems. No. So, I think it's important that, again, if anyone has, and that's why we're doing conversations like what we're doing here tonight, to allow you to be able to maybe ask those questions. Maybe, you do have a legitimate reason for the hesitation, and we understand that. We understand that not everyone's a quote unquote anti-vaxxer. Yeah. Again, maybe you have a legitimate fear that you really just need some more information. You can also call that number and just ask folks questions, and maybe just go over and visit with them. And again, get the facts sheet that they have available for you there to be able to read, to determine, which one is going to be the best one for you should you decide to do it. I think it's again, the phone number to call is 817-575-3700. We're talking with folks from the Arlington Fire Department as well as the City of Arlington. Got that has Councilwoman Nikki Hunter is online with us as well. She's joining us via Zoom. And again, you can go Monday through Friday, 9 a.m. to 4 p.m. In the city of Arlington from anywhere throughout the Metroplex. You don't have to be a resident of Arlington or Tarrant County to receive it. Now, we did have another question to come in. It says, vaccine incentives. Does the city of Arlington have any incentives, whether it be money or financial giveaways, or are you looking to add any, was the question.
No, we do not have any incentives at this time. We don't provide that. We just provide the service and go from there.
Yeah,
Yes.
yeah.
No.
But again, you provided the service to over 230,000
Yes,
people.
sir.
And looking to provide the service to another 230,000 or more, huh?
Yeah,
I would imagine.
Yes, sir. Yeah, it's we're again, when the boosters came out, we saw a big increase of those people that we back in January were doing our first and second doses and completing those series. Those people, as soon as they were, as soon as they heard about it, even though it wasn't approved completely, they're already knocking on our door. I heard the boosters out.
Yeah.
Not yet. As soon as available,
Yeah.
come on in,
Yeah.
and so forth. So it's been a lot of that. And it goes back to what we talked about earlier about how important the vaccine's been to so many people and certain demographics and age groups that you just see how thankful they are that they are vaccinated. It's been a very cool experience.
Yeah. Councilwoman Nikki Hunter, I want to come back to you. You heard Victoria talk about a moment ago how she's a public person, being out in the public. As I was reading your bio a moment ago, we talked about in your bio how you really like to get out amongst your district members and be a part of things going on out there. Has becoming vaccinated allowed you to be able to get back out into District 3 and kind of shake hands and I guess I was about to say shake hands and kiss babies. I don't know if they still do that. You still do that in public service anymore or not. What do you give the baby, a fist bump, I guess?
Mm-hmm. Fist bump, yeah, there you go. It actually has. I actually got my first vaccine. I worked over at a local hospital, and they gave us the option to get vaccines. And I, again, like Victoria, Nurse Victoria, I did weigh my options as well. And with my high risk health condition, I went ahead and decided to do it. So I got my first vaccine back a couple of days before Christmas of last year. And, I really didn't have any issues with the first one at all. The second one, there's mild, like you said, everybody's body's different. So I had some mild reactions, but it wasn't anything concerning. But going back to your question on there, I do feel it gave me the confidence to get back out. For a while there, I was definitely socially distancing myself pretty well. Away from people, and I think this vaccine has allowed me to have the confidence just to get out in the public, to do what I need to do in the community, to continue to meet and greet people, as which is what I love to do. So yeah, the vaccine does help with that confidence for myself.
Absolutely. Well, of course, like we talked about a moment ago, we're approaching the holidays. Anything exciting going on in District 3? Well, I guess that would probably, is that restricted to just District 3 members? Anything that you may have going on in District 3?
In my district for the holidays, definitely, we're going to have I'm sure there's going to be something fun going on. I don't have anything like right offhand. Thanksgiving Day, I usually do something. It's annually. I've done it since college. It's not really in District 3. It's over more in downtown Arlington. We usually help give out turkeys to the community. Again, I plan on doing that 100% this year for Thanksgiving. For Christmas, usually there's something with the Christmas store at one of our nonprofits. Another council member has a couple of projects for us to do to get out in the community and to help serve food to our homeless community. So looking forward to that 100% community work and just being able to do it this year. Last year, we didn't get to do a whole lot just because of the pandemic. Was the numbers were so high. So I think with anything this year, I think more people are getting out, going, visiting their families, visiting the grandparents, kind of coming together, doing projects and things like that. I think people will see more of that this year, no matter, not just in District 3, but just everywhere.
Yeah, I think you're absolutely right. I mean, I think in the state, we're starting to see more people getting out, and I think it's a good thing to see people getting out. And maybe you have plans to volunteer this holiday season. Maybe it's been a family tradition for you all, sort of like Councilwoman Hunter just spoke about, to go out and hand out turkeys and meals and serve meals to folks. Again, even if you're vaccinated, we're still encouraging you to wear your mask, still encouraging you to do those things safely in a responsible way. I guess, James, I want to come back to you. You know, one of the things we saw a lot of last year, or as a foundation, when we were out serving meals and things, we did the mask, we did gloves, things of that nature. Are we still encouraging as far as wearing gloves in addition to wearing your mask when you're out and about serving turkeys, things of that nature?
I mean, all social distancing rules should still apply in mass gathering settings. I mean, it only helps, especially with cold and flu season right around the corner.
Mm-hmm.
And, you know, I think that's one of the reasons that the flu season was so low last year was because of all the precautions we were taking. You remember, you touch a door, somebody's wiping it down and so forth. So all those things limited that transmission. So I think back to, like we talked about earlier, with people getting complacent, I think this year the flu season probably will be back up to what we're normally expecting to see, because people's guard has gone down on, decontaminating things in their house or at public places. Mm-hmm. So any of those benefits or, barriers will help.
Yeah,
that's for sure.
I know my wife. I mean, every time we go to Walmart, she has to pick up the hand sanitizer.
Yeah.
She couldn't get those things for a while because they stayed sold out. But now you can go and get plenty of them. I don't know if they just produce that much of them, or folks are just not buying it as much. But I guess as we talk about the holiday season coming up and families gathering together, again, I want to come back to Victoria when we talk about, and maybe there's some folks who just joined us who weren't with us a moment ago. How do you approach that conversation, kind of like your grandparents did with you? What was that one thing that they may have said that really made you said, okay, I've got to do what I've got to do to be around my family here?
Well, I just believed, based on, their encouragement for me to get it as a healthcare worker, I sat down and I spoke to myself. I'm the one who needs to lay a good example, for them to follow, and not them telling me what to do as a healthcare provider, because I just decided they actually telling the truth. Because ever since COVID came, we've not been able to hug. Good night, Granny. Good night, Papa. Everybody's doing COVID-19 handshake and hugs through the air. And that cordial relationship that COVID actually broke among families, it's something that we all need to think about this season and make sure we can go in during these gatherings and give Granny a hug, give Grandpa a hug everybody, and you are not scared of, in the next, 3-4 days, you start showing symptoms, or you come across somebody that has been infected, and you are thinking, I wish I hadn't gone for this gathering. We don't want that. So it's advisable. We still have a lot of time for you to come in for your first and second shot before Christmas. So it's good to go get the vaccine. Absolutely.
All right. And again, if you just joined us, we're talking tonight. It's a partnership between the Chris Howell Foundation and the City of Arlington. And we're talking tonight about COVID-19 and providing you with the facts so you can get the most accurate and up-to-date information. Again, so as we head into the holiday season, you can make the best educated decision for you and your family should you decide to get vaccinated. Again, from anywhere throughout the Metroplex, you can go to the City of Arlington, 2920 South Cooper Street there in Arlington, anywhere from 9 a.m. to 4 p.m. any day, Monday through Friday, in order to receive the vaccine. Do not have to have ID, do not have to have insurance or any of those things. Again, you simply go in and say, I want to become vaccinated. You can read factual information in terms of which vaccine is going to be best for you. You make an educated decision. You get the vaccine there, and maybe you're just needing the booster shot and you've received that somewhere else, you can certainly go there to get the booster as well. Or maybe you're needing the second dosage. Well, you can certainly go in and get that. Now, I guess that brings about a question though. Say, should someone have received the first dosage? Let's say they got it early on. Maybe they got it in March, April, I don't know. And now, is it too late? Do they have to start this series over again?
No, you don't start your series. You always just keep going. There's no, it just decreases if you go past your 28, like for Moderna, go past your 28-day, it just decreases the efficacy a little bit of the vaccine, but it's still, they recommend you still get your second dose when you can. Same thing with Pfizer. All of them, that's one thing about the COVID vaccine. We've been talking about some myths and stuff, and one of the myths, of course, has always been, well, if I get vaccinated, I'm not going to get, I won't get COVID. And that's not, as we've talked about, no vaccine's 100%. But there's also no other vaccines that have had this type of efficacy. I mean, all three of them are in the high 95 percentiles for contraction and for hospitalization. And ultimately, that's been our goal from day one, is to reduce the amount of people that are hospitalized. And all three of these vaccines provide that support. So that's,
Yeah, I think it's a good point, but I wanted to make sure that we addressed that because, again, like you said earlier, there are some folks who thought, well, I've already got my first dosage. You know what? I'm not going to go back for the second dosage or whatever. But now, should they be changing their mind as we get closer to the holidays? I think it's important for them to know that they don't have to start over. No. They can indeed go and get that second dosage and possibly come back later for the booster.
Yes.
Yeah. And I guess the other thing I'm going to talk about, are you guys offering the flu shot at your location?
We are not for the public, no, sir.
Okay.
Not at this time. But one thing on the boosters, with the FDA and the CDC working together and so forth, the parameters that they have laid out for the booster has been a little bit of an interest because they're allowing to mix and match your vaccines. Mm-hmm. If you got your Moderna first and second dose and you choose to get a Pfizer as a booster, that's allowed. The same thing with Pfizer, first and second, you can get Moderna. If you got a one-shot Johnson, but you want a booster, you can do a Moderna, you can do a Pfizer, you can do a Johnson booster. So the FDA and CDC have opened up the guidelines for us to allow people to even combine those vaccines.
Okay. I want to make sure we're being accurate in our information that we're putting out tonight because we're saying you don't have to have any documentation or anything. But if you're coming in just for a booster shot, do I need to have my vaccination card to show that what shots I've received?
Yes.
Okay, so that would be some documentation.
Yes, your
for
CDC
the booster.
card for the booster.
Yes.
And now if you came to us for either one of your series, we would have your information and be able to pull it. But we have to verify the timeline for your first and second dose in order to receive the booster.
Okay. Yeah, and I wanted to ask because I know you said there are the guidelines for getting the booster shot. Now, I guess there are parameters in terms of the type of work that you do, the age. What are some of the parameters that one has to factor?
It's pretty much, it's all broken down, of course. Immunocompromised is right off the bat. Mm-hmm. And then you have 65 and over, and then the different age groups, or if you're around somebody, the workforce, healthcare workers, teachers, first responders, so forth, and then anybody that could possibly become around somebody that's vaccinated. Not vaccinated or possibly contagious. So it's pretty much open to once 18 and over, you can get your booster.
Okay. Well, good deal. And again, it's all being offered in the city of Arlington for anyone from around the Metroplex. You have the opportunity to do it. That's why we wanted to have the conversation with the city of Arlington because, again, they're one of the few cities that's allowing you to come from anywhere in order to get it. So joining us in the studio, if you have just joined us, we have James Bach, who's with the Arlington Fire Department and Medical Operations. Also in studio with us tonight is Victoria O'Whaley. She's Arlington Fire Department Public Health Unit. And joining us on Zoom is Councilwoman Nikki Hunter from District 3 there in Arlington, the Arlington City Council. So Arlington, Nikki Hunter, before you get ready to jump off Zoom, because I know you had some things this evening, which is why you couldn't be in studio with us. Any final words or thoughts that you'd like to leave with the audience?
Yeah, definitely. One of the basic things too, along with, if you choose to wear a mask, whether you're vaccinated or not, always remember to wash your hands. It's one of the basic things that definitely, and I'm sure the nurse can definitely kind of back me on that, but just washing your hands, you go to a lot of places and you see signs just kind of reminding people, wash your hands for 20 seconds or so on there. But I think that's a basic thing as we go into the holidays that we need to remember is making sure that we're washing our hands, making sure that, now that Lysol is available, I'm not ashamed to tell you that I have Lysol all over my house. So make sure that you're sanitizing your house and you're sanitizing your hands, you're sanitizing your office. I think just those basic steps really do help as we approach the holidays and as those risks may increase a little bit. It's basic, it's just basically wash your hands and things like that.
Yeah. So you're already putting the warning out there for family members when they come, they're going to see Lysol all over the house, huh?
Yes, they will. They're going to smell it, yes.
I can imagine it's going to be the same thing at our house. So thank you so much for joining us tonight. And again, I know you had some things this evening, so really appreciate you taking the time to be with us tonight and really just sharing in the conversation that, again, I think is so important to so many people.
Here. Thank you for having me.
All right. Again, you too. All right. That's Councilwoman Nikki Hunter, District 3 there at the City Council in Arlington, Texas. And again, in studio with us tonight is James Bouquet. Bouquet. I've been saying Bouquet all night. Now I'm going to say James Boak. Listen
Yeah.
to that. But James, and just as we get ready to land this plane, we've got about 4 minutes left. We still have time, though. If you have a question, if it's a burning question that you've been wanting to get in, we want to make sure we get that question answered for you before we close out tonight. Because, again, we want you to go into the holidays with as much information as you can possibly have. But I want to come to James now. And James, again, any final thoughts? I guess Nikki raised a very good point talking about, again, remember to wash your hands, again, social distancing, things of that nature. Any other thing you'd like to leave with folks? No,
it's just like she said, is we need to go back to kind of like we were in the past with social distancing as much as you can. It's and the precautions. I think that will help. And one of the things I wanted to touch on earlier that we've discussed is there is breakthrough cases, but like we talked about, the vaccine is mainly to minimize the hospitalization. And those few breakthrough cases we do see are mainly minor and short duration, and again, limiting the hospitalizations. And as we discussed, our hospital numbers are looking as lower than they've been in a long time since this pandemic started. Again, we're cautious that we don't want that to go back up during the holidays. So we want to take all the precautions and take, again, you don't have to come to us. You can go anywhere. If you can get CVS or any of the other pharmacies by your house that can make an appointment, get in there. If you can't, come see us. We'll glad to take care of you.
Yeah, and like I said, you've been leading the efforts there in a big way since 2020, since August of last year. And again, you guys have had some pretty successful numbers in terms of getting people vaccinated. So again, I guess while you're not offering incentives, you are offering, I guess, the most convenient way. And I guess sounds like the most efficient way with folks being able to get in and out in a short amount of time. And
also, I think we're one of the few places that have all three vaccines available. So we've been very fortunate, and we keep, we just received some more Johnson & Johnson today. We try to order to keep, so we don't have any lag, and we're able to provide for that person when they come in for their second dose. If we take care of them for their first or for their booster, we want to make sure we are able to take care of them. So we keep all three vaccines on hand, which very few people can do.
Yeah. All right. Well, Victoria, you're the nurse at the table. You're the one who understands this thing better than James and I. But again, talk about, I guess, as we help to prepare folks to celebrate the holiday season in a safe and responsible way, what do you suggest folks do?
Well, my suggestion still goes in line with what my partners have spoken about, constant disinfection, constant hygiene, either you're at home or outside of your home. Make sure you keep a clean environment. And if you have people coming into your homes or offices, always have a sanitizing spray to disinfect. Put on your table when they come in. After handshake, try to sanitize. So during the gatherings, we should try as much as possible. If it involves a lot of crowd, try to practice social distancing. That will still help to reduce the spread come January 2022. We don't want the numbers to go up. For parents that have gotten their vaccine and their children is of age, according to CDC guidelines, to get the vaccine, they should please give their consent for those children to go get vaccinated.
Absolutely. Well, again, thanks to both of you for being with us tonight. Again, tonight's presentation has been a partnership between the Chris Howell Foundation and the City of Arlington. So again, we're grateful to each and every one of our panelists tonight for being here with us. And tonight has just been an effort to really try and arm you and your family with the most accurate information to be able to answer some questions for you so that as you go into the holiday season, you don't have to go into it with fear. Again, for those who have been vaccinated, again, helping you to also understand that while you may be vaccinated, you do need to practice extreme caution in terms of wearing the mask, things of that nature, and social distancing where you need to, so that everyone can remain safe even beyond the holiday season. And for folks who are not vaccinated, again, presenting you with the opportunity to make contact with them over in Arlington. Again, it's the Fire Department Public Health Unit at 2920 South Cooper Street, Arlington, 76015. Again, the phone number is 817-575-3700, 817-575-3700. We understand we're on the World Wide Web and not everyone is in the Metroplex. But again, if you're coming to the Dallas-Fort Worth Metroplex, maybe from another area and you're not vaccinated, again, you also have the opportunity. No registration required, no ID required, not even appointment required for you to go and see them over there in between 9 a.m. and 4 p.m. Monday through Friday. So again, it's just another way the Chris Howell Foundation wanted to provide information to the community. So again, thank you so much for spending time with us tonight. We hope we've answered your questions. Should you have any lingering questions, put them online and we'll make sure we circle back and get an answer to you. In the meantime, have a great night and a great holiday season.